We know we are in still a very rapidly rising infection rate and rising hospitalization rates, which is extremely concerning. We know that there is some good news around the world that some places look like that they have hit a peak, even in the United States. But we do believe we are in for several weeks of very hard slogging in Washington State, where all of us have to pitch in together, because we don't know where that peak will be. It's likely to be later than many places because this hit us later than many places in the United States. And the hospitalization rates will continue to go up even after the infection rate peaks, because hospitalizations follow the peak of the infection rate. So we have some work to do in the next several weeks, and we have some things we're going to talk about today to help us through that difficult period. First, we want to talk about how to help our hospitals. Hospitals and doctors have told us that their systems really are now in crisis because of this Omicron surge. And so we are responding to those concerns today in ways that we can help. We currently have over 2,000 COVID hospitalizations across the state, and COVID patients today make up about 18% of all the people in our hospitals and 22% of our ICUs. And unfortunately, those numbers are going to continue to climb. Now, we know roughly about 80% of those people, unfortunately, are not vaccinated. So there are many things we need to do to try to help our hospitals through this crisis. First, we want to help them with staffing shortages. And this is really, most of the problem is not a physical logistics problem, it's a staffing shortage problem, both because of the increase in cases and because people who work in these hospitals are themselves becoming ill. So we know that the staff shortages have pushed hospitals beyond their capacity. So hospitals have told us that they believe having some National Guard personnel can help them. So I am ordering 100 members of the Washington State National Guard. This is non-clinical personnel across the state to help hospitals to assist in non-medical tasks, to alleviate issues, particularly in their emergency departments, and also to add testing capacity at these hospitals to get the testing to alleviate the challenge in emergency departments. By the way, I note that this is non-medical personnel, and we'd love it if we thought the Guard had, tons of medical personnel. We do have some people who serve in our Guard that are medically trained, nurses and physicians, but it's not a solution to take those nurses and physicians out of their civilian employment, where they're today working in hospitals, put them in a Guard uniform, and then put them back just where they were working. That doesn't increase capacity. But we know the emergency rooms are full. More people are showing up all the time. We want to help hospitals handle the volume of patients. And we think that the Guard can help in a variety of tasks. We're going to call up these individuals for a month. We really appreciate them coming out of their civilian life to do this. They've been working really, really hard the last 2 years, and we appreciate their efforts. We're going to send that personnel to Providence Regional Medical Center in Everett, to Yakima Valley Memorial Hospital in Yakima, to Confluence Central Washington Hospital in Wenatchee, and Providence Sacred Heart in Spokane. Now, we'd also like to help by doing some of the testing now doing hospitals, doing outside the hospitals. So we're going to deploy Guard personnel to run those testing operations. We've heard that from the hospitals, and many people with COVID symptoms are seeking testing in the emergency departments. We want to alleviate that pressure on the emergency departments. So those testing teams will be placed at Providence St. Peter Hospital in Olympia, Cadillac Regional Medical Center in Richland, UW Medicine Harborview in Seattle, and Multi-Care Tacoma General Hospital. It'll take a week or so to set up those testing centers, and what we're doing as fast as we can to get them set up. We're also, of course, pleased that we're going to have FEMA mass testing sites being set up in King and Snohomish County. Now we're looking for other ways to help as well. One of our problems in our hospital capacity is we today have quite a number of patients who are ready to discharge to other types of lower intensive care, but we don't have a place for them to go. So we want to increase the capacity of the state to give people additional places to go after their discharges to still receive the care that they need. Now, those are our long-term care providers, but they themselves face dire shortages in staffing, which means they have less capacity to admit individuals from the hospitals. So they're stuck in the hospital. And so we want to try to increase that capacity in our long-term care facilities so we can get more people out of our hospitals appropriately. Obviously, that's contributing to the strain. So we're going to expand contracted staffing and dedicate more staff to provide care in our nursing homes to increase their capacity to help patients who no longer need the intensive care in a hospital. We had already done this with 60 contracted staff in the months before. We're going to increase that by another 200, and that'll serve probably about 240 more residents that we can get out of our hospitals. We'll be able to serve at least another 75 people also who need guardianships. We hope to increase our social service staff and area agency to help with the assessments that are necessary to help accelerate people being allowed to go to a really more appropriate setting outside of a hospital. So we're going to acquire additional assessment staff to work with patients on transitioning, in selecting providers, in expediting their eligibility work to get assistance. We're also going to contract with the area agencies on agency at high volume hospitals to help patients who are not relying on Medicaid for their transition. We also are creating a program to engage more guardians. Some of these folks who are not competent to make decisions on their own under current law require a guardianship. So we want to provide more resources to get more guardians so we can accelerate that process. This will help people without the capacity to make decisions and hopefully expedite people's transition out of hospitals into more suitable care. Now, we wish that was an overnight process, but we want to accelerate it as fast as we can by having more guardians to work on this. So we're also going to provide incentives for strike teams for long-term care so that they can themselves, accelerate their staffing levels on their own employment. Now, also a way to alleviate some of the stress on hospitals is to reduce the demands for some of the work they do and the procedures they do. And this is one of the ways to increase capacity to deal with this Omicron surge, obviously. So we are going to be requiring hospitals to temporarily halt non-urgent procedures so as much capacity and staff can be dedicated to emergent needs, the people who need this right now, not just for Omicron patients, but for heart attack victims, for car crash victims, for gunshot victims. They all need help right now. And this is a difficult, but it is a necessary decision to make sure people get access that is life-saving right now. So many hospitals are already doing this to help utilize staff in other areas of the hospital. The University of Washington Hospital System has already taken this action voluntarily, and they have successfully redeployed staff to other areas of their hospital, make sure they can take care of these life-saving issues. So when we're looking across Washington, we really need to make sure that all hospitals are sharing this effort so that we can transfer people amongst hospitals depending on what their demands are and their staffing levels are. So basically, we got to make sure all hospitals help each other to make sure that no one hospital goes too deep into this capacity crisis. Now, I know this is going to delay some care that we may want, and none of us should be happy about this. So I think we're appropriately disheartened to find ourselves in a situation that so many people are not vaccinated. And like I said, about 80% of our people in our who are being treated for COVID right now are not vaccinated. So we should not be happy that the fact that so many people are unvaccinated have put us behind the 8 ball on this. But that is the situation. We should also not be happy about people spreading misinformation about this deadly disease and the vaccine. Frankly, I think everybody should be enraged about this internet hoax that Republican politicians yesterday scared the living daylights out of 30,000 people, telling them they were going to be put in concentration camps if they weren't vaccinated. It was a bunch of baloney, and it scared people to death. And that's got to stop. And I'm calling all Republican legislators to stand up and speak against this and denounce those who are responsible for this internet hoax. This is dangerous for our people to scare them like this. And it certainly makes it more difficult for our medical personnel to really help people save their lives. So just a little bit more about this decision. Look, the determination of what is urgent procedure is going to be left to the physicians in this regard. So if a physician identifies harm or a worsening condition or deteriorating health of a patient, that procedure can still be done under the physician's discretion. So we're going to leave it in the capable hands of physicians to determine the appropriate needs under this direction. That'll last for 4 weeks. We think that's a reasonable time, hopefully, to get through the peak of this. And we know people are working real hard. We want to thank everybody in these hospitals, everybody in the hospitals, for their incredibly hard work in this regard.